Thank you all for coming today. So as Dr. Heatwell and Dr. Thornton both alluded to, is that physical therapy can play a role in helping manage the symptoms of myotonic dystrophy. So physical therapy can help by promoting optimal health and wellness. It can help prevent and delay secondary complications that arise mainly from musculoskeletal weakness. It can help manage and maximize functional abilities. It can help improve and increase participation, so the things that people need to do throughout their day and in society. And ultimately, we hope that it helps improve and maintain quality of life. So as one of the first goals, I just wanted to take a second and review the definitions of health and wellness, because it is so important for all of us to optimize these things. And so health is actually a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. And that was a definition established back in 1948 by the World Health Organization. And then wellness, while slightly different, is the active process through which people become aware of and make choices towards a more successful existence. And I think we all have those opportunities on a daily basis, and some of the things that I'll talk about can relate to that. So we know that individuals with myotonic dystrophy have a progressive decline in strength. And we also know that inactivity and aging also result in loss of muscle strength. So physical activity and exercise are essential in minimizing strength loss due to disuse weakness or inactivity. So in this previous year, there was an update to the physical activity guidelines. These were originally published in 2008 and then updated again this past year. And what they say is really kind of what individuals in society should be doing from a physical activity standpoint. And that means all of us. So they recommend that aerobic training occurs at a moderate intensity for 2 hours and 30 minutes per week. So that could be 5 days of 30 minutes. They also recommend that resistance exercise is performed in all major muscle groups 2 or more days per week. And just for an understanding of what moderate intensity is, from an aerobic standpoint, it's the level of exercise and activity that raises the heart rate and the respiratory rate, but it allows someone to continue a conversation, but you may not be able to sing when you're doing moderate intensity exercise. So that kind of gives you a ballpark range of how much you should be working to accomplish moderate intensity. And some of those examples are brisk walking, water aerobics, cycling, dancing, and gardening. So what if that's difficult for you because of your disease process? They did make recommendations for individuals with disabilities, and what they recommend is that they should follow the adult guidelines, but if it's not possible, people should be as physically active as their abilities allow, and certainly probably the most important part is they should avoid inactivity. So we know that physical activity and exercise has many, many, many benefits. From weight control to reducing risk for different metabolic conditions, reducing risk for cancers, strengthening muscles and bones, improving mental health and mood, which is certainly important as well, and improving your ability to do your day-to-day activities, and also improving the ability to live living longer. But the question also always comes up is exercise okay for individuals who have a muscle disease? And so for a long time, individuals with muscle diseases were told not to exercise because we didn't know what it was going to do, or we were worried that it would increase the risk of losing more muscle mass or muscle strength because of the exercise, because you're taxing the muscles. So over the last several years, probably 2 decades, work has been done to better understand the impact that exercise has on individuals with muscle diseases. And so really the bottom line, I have a few different references here, but the bottom line is that the most recent literature would say that exercise at that moderate intensity level is safe for people with slowly progressive muscle diseases, of which myotonic dystrophy is considered one of those. There's also been some additional research that would go to start saying that it would also may be effective for people with myotonic dystrophy. And then the last review was really kind of the gold standard as far as evidence is, and again concluded that strength training appears not to do harm for individuals with neuromuscular conditions or slowly progressive neuromuscular conditions. And then to give a little bit further knowledge, there have been a couple of studies more recently that look at people or individuals with myotonic dystrophy specifically and not combining all of the slowly progressive muscle disorders together. And so there was this retrospective study done by Brady et al., and he looked at the differences in strength in individuals who were habitually active or sedentary. And this was done as a retrospective chart review. So as you came in to see your doctors, they would be asking questions about your exercise routines, and they went back and looked at the charts after that and found that people who were engaged in regular exercises demonstrated a stronger grip, stronger elbow flexors and knee extensor strength than their sedentary counterparts. And so those that, and the data that they collected, that those that began an exercise program during their visits demonstrated 24% gain in knee extensor strength. And again, just a caveat that this is not very stringent research, it's really just chart-based reviews, but I still think that a 24% gain in strength is pretty phenomenal. And we have seen situations like this in our natural history studies where we've documented that individuals have started an exercise program and the trajectory of their strength has changed and actually improved over the course of the study. There's also a recent review that looked at 21 different papers looking at the effects of exercise programs in individuals with myotonic dystrophy type 1. And these were all sorts of intervention programs, so everything from electric stimulation, strength training, aerobic training, balance training, and then combined interventions as well. And again, they reported that there were positive effects on patient-reported outcomes, so how people felt that they were doing, their aerobic capacity, and then and muscle endurance. And there was an improvement in function, so the ability to go up and down stairs or go for a walk in 4 out of the 10 studies, and then an improvement in strength in 9 out of the 11 studies. And again, they also confirmed that there were no adverse effects of participating in exercise, but there's really still not a lot of evidence to be able to say what kind of exercise, the type of exercise, the duration of exercise, how many days a week, or how intense it should be to really guide our recommendations of exercise. There was also recently a study that was completed called the Optimistic Study that looked at exercise in combination with cognitive behavioral therapy. And the cognitive behavioral therapy focused on individuals that had reduced initiative, trying to increase physical activity, improving social interactions, the sleep-wake pattern that Dr. Heatwell was just talking about, pain, and then also addressing beliefs of fatigue. And what they noted is in this combination group where the individuals received both cognitive behavioral therapy and physical activity and exercise, that it improved fatigue and exercise capacity. So I think, again, the conversation that was just had about fatigue, I think there is some evidence that exercise can help improve some of the types of fatigue that individuals experience. I would also just say anecdotally, as part of our research studies, individuals are asked to perform a 6-minute walk test. And that's walking back and forth between cones as far as you can walk. And we ask for people to rate their fatigue before and after the test. And in many individuals with myotonic dystrophy, and again, I have never looked at this data specifically, but many times after 6 minutes of walking, people will actually report that their fatigue is less. So just consider this as potentially a way to help manage some of the fatigue symptoms that people encounter. And then last, there was just a recent study that looked at actually the impact of exercise on the cellular mechanism in mice. And I found this study to be interesting because, again, we've always thought about exercise at least maximizing abilities because it reduces disuse weakness and it reduces age-related weakness. But there's a question on whether or not exercise can have an impact on the cellular mechanisms. And what they noticed is that there was increased performance and motor performance, so functional things, strength, and endurance. And they also noticed that there was increased mitochondria, which again can help from a fatigue standpoint. They noticed that there was reduced RNA toxicity and improved mRNA splicing. Now this again was a study that was done in mice, but we have to look at these things in mice before we progress to humans. So certainly I found this really interesting as we consider the benefit of exercise in individuals with myotonic dystrophy. Just a quick word about physical activity and exercise. I've used them kind of interchangeably. Physical activity is really kind of the things that we do day to day. So that could be, taking care of household tasks, mowing the lawn, those kind of things. Whereas exercise is really kind of a subset of physical activity, and it's kind of those things that are planned, it's structured, repetitive, and kind of has a final or intermediate objective of the improvement or maintenance of physical fitness. So that can be more of your targeted exercise interventions that you may do on a regular basis, go to a class, do your physical therapy exercises, things like that would be included more into exercise. And so there are different types of exercise. So stretching exercises, which address range of motion and how our joints move, strengthening or resistive exercises, aerobic exercise, which is more of that increased your heart rate, aerobic capacity, and then balance training. So again, range of motion is really, it can be done in many different ways. So if you're moving your joints against gravity, we just kind of consider that to be active range of motion. Sometimes where muscles get tight, we need somebody to help stretch, and that would be more of like a passive range of motion. Sometimes gravity, it's a pretty nasty force, so gravity pulls us all down quite a bit, and so sometimes moving muscles against gravity is very difficult. So sometimes doing those things where gravity is minimized, so maybe performing exercises lying down may be more easier to do to achieve those range of motion. And range of motion exercises may also help decrease pain. And again, that's sometimes where different muscle groups, a strong muscle group is pulling harder than a weaker muscle group, and so that muscle imbalance can create some pain around the joint. And sometimes range of motion exercises can help manage that. Aerobic exercises are more those ones, again, that are going to increase your heart rate and your respiratory rate. So things like cycling, walking. The water environment's a great environment to exercise in, dancing, gardening. And again, it's where you're raising your heart rate and respiratory rate, but you're still able to talk is that moderate intensity level. So resistive exercises can be done in many different ways. So body weight can be used as a resistance, just as much as gravity. I mean, I guess body weight is kind of a combination of gravity in many situations. We can use free weights for resistance. You can use machines. Some of those stretchy elastic bands provide resistance. Sometimes in very weak muscles, soup cans are great tools for resistance. And again, in the water can also create resistance, so working in an aquatic environment where it helps support weaker muscles but also provides resistance against some stronger muscles. And when we talk about moderate intensity resistive exercise, we're talking about a level of resistance that you can perform 12 to 15 repetitions of. So we want to keep it up in that higher range, not down in that, oh, I can only lift this weight 6 times, because then you may be taxing your muscles too much, and we just don't know the impact that that may have on people with myotonic dystrophy. I would also mention that balance training is a form of exercise, probably most commonly if it's multidimensional, so it can include strength training, because strength training needs to have, muscles need to be strong to be able to react to perturbations in your balance. Range of motion sometimes is also a part of making sure that you have good balance reactions. And sometimes just making sure it's task-oriented, so things that you have trouble with, if we practice them in that way, both the way that our brain works as well as the way that our muscles respond can also help improve balance. And then we can also improve balance by using the different sensations that contribute to our balance system. So our vision and our vestibular system, which is the inner ear, and then our sensory system, the way we feel the ground, all of those systems come into our brain and tell our body where it is in space, and then our brain kicks out a message and helps our muscle groups kick back in to maintain an upright position. So those systems all have to work really closely together, and sometimes they're not in sync, and so sometimes balance training activates those different sensory systems can be helpful. Balance training using Tai Chi and yoga are also more formal kind of programs that can help address balance deficits. But I think one of the most important things is that we know that sedentary lifestyle is probably the most detrimental thing that we can do. And I think that's, again, across society that we spend a lot of time sitting. And in a small study that I did, we noted that individuals with myotonic dystrophy were noted to sit 7.5 hours every day. So I guess the bottom line is to be as physically active as you're able to. Set a timer and get up and move around. I think that sometimes we're talking about scheduling and routine, and sometimes that helps with making sure that we're moving. Sometimes the challenge is how to get moving, just what can motivate us to get moving. And so a couple of things that I wanted to just mention as far as addressing motivation and encouraging people to be able to be active on a regular basis is sometimes making sure you plan ahead. So putting it on your calendar, making a date with a friend to go for a walk or to go into the gym or do something, using an exercise group or a class, and again, even if you needed to modify that, to have something that's regularly scheduled can sometimes help our participation in physical activity. As far as dealing with the barrier of fatigue or lack of energy to participate in physical activity, again, sometimes scheduling the physical activity when you feel most energetic can help. And then convincing yourself that if you give it a try, maybe physical activity will actually increase your energy level. And then try it. And sometimes that takes time. It doesn't happen. Those first few weeks of doing extra activity can actually make you feel more tired, but in the long run, as your body adapts, it can help manage the fatigue. So I wanted to speak a little bit about specific physical therapy interventions that we can help with people with myotonic dystrophy. So physical therapy is actually individualized care, so people come in and will get evaluated by a physical therapist, and we help them work on creating goals that are going to address the limitations that they are having challenges with. And so we work as a partnership in a partnership with the patient to help establish these goals. And with that, we establish the type and the frequency, the intensity, and the duration of physical therapy. So it may be that kind of, I'm going to see you twice a week for these exercises or for working on balance or whatever it may be that's part of the plan. And we come up with this and then carry it out. And some of the most common areas that physical therapists can address are, again, making exercise recommendations, so helping establish specific programs for people with myotonic dystrophy or other conditions. We can help with prescribing and evaluating for bracing or orthotic care. And then we can help with assistive devices. So as we mentioned a little bit earlier, is often with the distal weakness that many people with myotonic dystrophy experience, that they often will have a foot drop where their foot doesn't necessarily clear the ground when they're walking. And so using different types of braces can help make sure that foot gets cleared when they're walking. It can make walking more efficient. So if you think about it, if you have to pick your foot up higher every time you take a step, you're using a lot more energy to walk. And so bracing and to help facilitate that keeping that foot up can help with from an energy perspective as well. There are several different braces on the market. And on this slide, everything from what we call a foot up, which is just a Velcro cuff that goes off around the ankle with a piece of plastic that slides into shoelaces, can help keep the foot up. There are many different types of carbon fiber AFOs, which are, the technology has come a long ways in the last 7 years or so, where there's many different types of carbon fiber braces. The benefit is that these braces are often off the shelf, so you can go to an orthotist and try many different types on and decide which type may work best for you and to fit your needs without having that commitment to buy. So previously we would use that heavy propylene plastic to make braces, and then once you were molded and the brace was made for you, you kind of had to take it. And so with the use of carbon fiber braces, you're able to kind of pick and choose and decide which ones may work. The other benefit that they have is that many times you don't need to change your type of footwear to accommodate the brace. And so you can wear these maybe if you're going for a long walk or you're going to be walking on uneven surfaces, types of mobility that are more challenging to you and that a brace would be beneficial for, but you may not need it all the time. So now that you can kind of slide it in and out of your shoes a little bit easier, I think it allows for individuals to kind of choose when that they want to be wearing their brace. And then assistive devices, so lots of different things can be used to help with balance and mobility. And as I think about making these recommendations is that when individuals start talking about not doing the things that are important to them in life because of their mobility, I help to encourage them to think about using assistive devices, either canes, walkers, and walking sticks, all the way to scooters or power wheelchairs, and that will be my next slide, to be able to make choices and to be able to go and do the things that are important to them. Because again, if both from an emotional standpoint and a societal standpoint, if you aren't able to access your environment because of mobility, then your environment becomes smaller and you're not doing as many things, which certainly can lead to decreased quality of life. And then the other piece that, from a physical therapy standpoint that I get concerned of is if you're not going and doing as much as you were, and that world gets smaller, now you're doing even less and less, and again, then we are subject to disuse weakness and age-related weakness that also compromises overall mobility. So both from a quality of life standpoint as well as a disease wellness standpoint. So different types of assistive devices can be used to as balance aids to just help give some extra basic support. And then in the next slide is just all the different types of mobility devices, manual wheelchairs to power scooters to power wheelchairs that can all be used again to help individuals access the things that are important to them on a daily basis. That's all I had. So, good.